Oklahoma doctors addressing a report adding to the misinformation about COVID vaccine.
News 4's Austin Brissett spoke with two of the Metro's top docs today, and Austin physicians, these are saying the report is really nothing to draw conclusions from.
Yeah, that's right, Kevin. Heather, it's a survey report on the adverse effects of the Pfizer COVID-19 vaccine. Every new drug or vaccine goes through it, and doctors who read the report say this isn't anything out of the ordinary.
I think people who have an agenda are going to read into this whatever they want to read into it, and I have no problem calling them out on that.
A surveillance report monitoring reported adverse effects from Pfizer's COVID-19 vaccine released this week, and Oklahoma doctors are now providing context to the over 35-page report.
Reading this study would be the equivalent of me trying to read a technical service manual on a Boeing 737. It's not going to go well.
They capture information on any adverse events that are reported.
Dr. Dale Bratzler with OU Health referencing page 7, where it mentions out of just over 42,000 people that received the vaccine, more than 1,200 are listed on a line as fatal. But that doesn't mean the vaccine killed them. Dr. Bratzler adding that doctors were required by law to report any death of a vaccinated person, no matter how it happened.
They died of some other underlying disease. If you look at this particular surveillance report, quite a few of the people who died had COVID-19 when they got vaccinated. They died from COVID-19.
Bratzler also says most of those in the report had no issues. And the report itself also states those conclusions cannot be drawn due to voluntary reporting for the public.
Because the denominator is those people who voluntarily reported something, not the denominator of people who actually got the vaccines. It has nothing to do with the actual incidence of a side effect or event that happens because somebody took this particular agent.
The report even concludes with a beneficial risk to reward ratio. Dr. Chancelm saying other studies have proven time and time again it works, it's safe, and it's effective.
1,200 people did not die from the vaccine. There's nothing better than just seeing how it performs in your real life and everything like that. We have evidence-based medicine. We have anecdotal-based medicine.
Well, there are also a list of potential side effects in that report. Bratzler says it's nothing that they didn't already know. He also sent me a detailed U.S. study of 6.2 million people, and it shows side effects that happen in vaccinated people are just as common in those who chose not to get vaccinated.